Hello beautiful people, how are you doing? So in this video I just want to tell you that once you finish your paperwork and you're coming to the UK as a nurse, you need to know that you're not coming and from day one you're working as a nurse. Okay, you are not going to do any of the most of the nursing roles really until you pass your OSCE exam. For example, when you go to the ward, you will not be able to give injection, you're not able to give medication like drugs, you're not able to give patient like disconnect, even like the most simple and basic things you'll not be able to do at all until you pass your NMC OSCE and then become a band 5 nurse fully, okay, with your PIN. You will work as a healthcare assistant, either band 3 or band 4, depending on the hospital that you'll be working in. I worked as a band 3, and the roles you're doing are the simple roles, turning patients, giving them water, and helping in wheeling them from one place to another. Just simple roles, documenting input, output, doing observations and things like that. So for me it was funny sometimes. You're in the ward, these patients want to go to the toilet, you just want to disconnect an IV fluid from the hand, but you cannot do it. Why? Because you're a band 3, you're not a staff nurse. Go and call the nurse, come. The nurses are busy. This patient just wants paracetamol, just paracetamol. The nurse is busy. You are here, you're a qualified nurse for many years, you cannot go get paracetamol and come and give them. Why? You don't even have access, you're not even allowed to touch the medication trolley or anything like that, So I used to feel, I don't know how sometimes, those most simple of the simplest thing that you do as a nurse, you cannot do them until you get your band 5, until you pass your OSCE. So until you pass your OSCE, if it takes a month or 2 or 3, that is how long you will work as a healthcare assistant before you start doing. And even after you passed your OSCE, you will still be under how do you call it, supernumerary, maybe 6 weeks, maybe 2 months, maybe a month, depending on your workplace and how quick you will learn and be able to work independently. So don't be too excited that from day one you'll be a nurse, and also don't be worried that you will not know what to do. This period that you will work as an HCA, take that time to know how things work. Get the nurses, ask questions, tell them to show you how that medication administration system works. Here in the UK they use Quadramed, this is called Flex. Learn how it works, take your time, know which equipment works where, know which one, attend the trainings and be keen to learn new things, so that by the time you start working independently you have mastered many things. You're just polishing here and there, okay? So take your time, learn those things during that period. And during supernumerary also, ask a lot of questions. Ask questions, ask those RN questions. I have met some nice, of course, some of them will not be willing to teach you. Some of them are very willing. I realized that the international nurses, especially who come from outside UK, are so willing to teach you. They will teach you. Just ask questions. Yes, they'll guide you, okay? So just know you will not work as a nurse straight away. For those ones who have been asking me questions and they are worried that they will not know how to start, just know you might stay about 3 months even before you do any nursing roles like medication, like injection, like ECG, So calm down, take your time. You have enough time for orientation, you have enough time to learn basic things, how things work here. Just know that most things are different. They don't work the same as how it works in Kenya, how it works in Nigeria, how it works in Zimbabwe or wherever place you are. But don't worry, you have the time to learn and understand these things, okay? So that's all for today. God bless you. Bye.